You're listening to Metroscope, a series of interviews with people of interest in Northwest Oregon and Southwest Washington. I am your host, Ted Douglas. We cover a lot of topics on this show, and one that comes up from time to time that's always pretty fascinating to me is the topic of healthcare. And today, we're going to focus on a specific type of healthcare, women. You know, that small little group, women. About a little more than half of us, I believe the stats work out to be. So please welcome to the show today, Brian Kelly. He is the CEO of Women's Healthcare Associates. How are you, Brian?
I'm very good.
Thank you so much for joining me today. Well, let's get things kicked off by letting our listeners know a little bit about yourself and how you came to be with Women's Healthcare Associates.
Sure. Actually, really my entree into healthcare was I was an intern for Governor Mario Cuomo in New York State.
Wow.
And that was my senior year in college, and I was studying or advising around the impact of Medicaid cuts in New York State. So it got me really interested in healthcare. And then I actually came out to Portland as a Jesuit volunteer, and I ran a clinic for people without health insurance in Northeast Portland for a couple of years. I was the coordinator of the clinic. And that really kind of had a very significant impact for me at a very relatively young age around service and my desire to really kind of run and be a part of medical clinics. So from there, I worked at Multnomah County Health Department. Multnomah County has a very robust primary care clinic network, and so I worked with that population, worked in those clinics. And then from there, I went to the Portland Clinic. And from the Portland Clinic's large multi-specialty clinic, I was the associate administrator. Then in 1999, I became the CEO of Women's Healthcare Associates, where I'm at today.
Wow.
I partly share that because I think I do have some of a unique perspective in that I was in the private nonprofit, the public nonprofit, and then in the private sector. And so I think with all the things we're being faced with in healthcare today and healthcare reform, I think it gives me a pretty good platform for
Yeah, you have a fairly unique perspective because you've kind of been on most of the sides of this thing.
So I was a little long-winded, but that's why I share that.
Oh, that's all right. Now we know who we're talking to. So you said you started in 99 with Women's Healthcare Associates.
Right.
How long has that organization been there?
So actually, women's healthcare really is quite a long history. Some of the early pioneers of women's healthcare in Portland. Some of the listeners may remember the Lloyd Center Women's Clinic, which actually opened in the 1940s on the Portland's east side. Also, West Hills Women's Clinic, which opened in the 1960s near Providence St. Vincent's. And then Lake Grove Women's Clinic, which was founded in the late 1970s by actually our current chief medical officer.
Cool.
And these groups came together in 1999. A number of them came together. And then in 2000, actually WHA merged with Women's Clinic and Women's Health Center of Oregon. And so that resulted in about a group of 90 providers in 11 clinical locations. And those clinical locations are in Portland, Oregon City, Canby, Tualatin, and Newburgh. So we actually cover the Portland metropolitan area with our clinic sites.
Yeah, I would say, and then some. Going down into Canby and Newburgh, you're even getting a little bit of the outreachers. That's fantastic. So you have, as we said, hit a lot of different sides of healthcare. What is it that is special about Women's Healthcare Associates?
So when I think about uniqueness with medical practice, one, we are a large organization for a medical group, private medical group, and we are very tightly integrated, and not only integrated on our business processes, but also on our clinical processes. So we have a common electronic medical record, and not only do we have that electronic records that sort of captures the data with patients, and that data can be shared. There's much that goes around quality improvement and the clinician, sort of the clinical integration of our practice. So the clinicians talk through best practices, determine what those are, and then agree as a group to follow those. And with a large group like ours and being able to get that kind of input and come to consensus on that's relatively unique. Also, our ownership structure. We have not only physicians, but nurse midwives, nurse practitioners, and genetic counselors that are actually owners in the practice. So typically in a medical practice, the physicians would be the owners, at least in the private practices. So we have all those clinicians who are invited to be owners, and we really value the collaboration with these different types of providers and their perspectives, and we believe it results in innovative care, and ultimately we believe that we'll be able to come up with affordable and high quality care through the fact that everybody has ownership in the success of the practice.
Sure. That makes a lot of sense, especially considering what's happening with a lot of the HMOs out there, kind of becoming these big corporations and that almost becoming the point rather than the helping people.
Right. We hope that does that. And I'll just add one other. We've always been very focused on continuous improvement. And while we can't claim to be the only healthcare organization that does that, I can tell you it's just ingrained into our culture. We hire great people, and they're highly skilled in their areas of expertise. But from there, we focus on how we continually can make service to our patients better, how we can evaluate and improve our clinical care, and with that, evolve as an organization.
Right. Well, I think it's a natural progression for your organization. I mean, you went through the whole history of how WHA came to be, kind of evolved out of various groups that have been in this area for a very long time. And then you look at the merger you guys did just a couple of years ago with Women's Clinic, and it makes sense. It makes sense that this would be kind of your business model, for lack of a better word, for everyone to be supportive, everyone to be collaborating together. Yeah. So when you did do this merger, what did you guys gain? What were some of the bigger changes?
Well, we are larger, so now there was 2 groups on the east side and then 1 group on the west side. So it gives us the ability to cover the metropolitan area, so just sort of a geographic footprint. And it really has facilitated our ability to collaborate well, both with the hospital systems that we're involved in and the health plans, to be able to say, you can rely on these certain goals or things that we can follow through on. We can commit, and you can, throughout the Portland metropolitan area, count on that. So let's say if we're going to do extended hours, you can rely on the fact we're going to have extended hours throughout the Portland metropolitan area. You can count on, we're going to do Pap smears per the guidelines that have been rolled out by ACOG, and you can count on that throughout the Portland metropolitan area. That will happen. So that was one of the things we gained.
Mm-hmm. So let's also hit, it is Women's Healthcare Associates. So certainly there are areas other than just general medical practice. You guys also have areas that are focused specifically on women. So I imagine that gynecological care is a huge part of that.
Yes, and back in 2009, we did some focus groups, and we recognized that we needed to make a change in what we did. And so we started the Northwest Gynecology Centers. And prior to that, most people, both women and families, when they thought of Women's Healthcare Associates, they really knew us for our obstetrics and delivery of babies. But we've always partnered with women to achieve their optimal health throughout their lives. And in 2009, we chose to establish our first center of excellence in gynecology, which we called Northwest Gynecology Center. And although our doctors, midwives, and nurse practitioners, they all practice gynecology, Northwest Gynecology Center really is devoted exclusively to gynecology service without the competing demands of a busy obstetrics practice. So, the physicians, the clinicians aren't needing to run out during the clinical day and go deliver babies. So the service level can be a little bit different and higher in these Northwest Gynecology Centers. We also are able to add subspecialties that again give us a deeper bench in terms of being able to serve women for their gynecology needs. Within those centers, we also have mammography, bone densitometry, and office surgery. So they're comprehensive gynecology service centers. And we currently have those in Tualatin and Southwest Portland, but later this year we hope to open one of those centers on the east side of the river as well.
Very, very cool. So speaking of some of the innovation that you guys have certainly come upon here in your business as it has evolved over, decades to get where you are, really. Tell us about your approach to some of the changes that are going on in healthcare. Certainly it's a very fluid industry.
Right. Yeah, this is the most challenging time that I've experienced since I've entered healthcare, and when I've talked to folks that are even older than me, they say the same thing. So in some ways that's reassuring, but it is challenging, and it's also really exciting. One of the filters that we've really adopted as we're really looking at better ways to do things is what's known as the triple aim. And we use this triple aim to really evaluate innovation and change. Triple aim as a concept was first authored by the Institute for Health Improvement actually many years ago. But it's a significant piece of work that also informed the Accountable Care Act, which is also known as Obamacare. And really the triple aim is where we're being challenged to lower cost, improve the health of a population, but also improve patient satisfaction. So that's the triple aim, the cost, the improved health, and then satisfaction. So that's the lens that we look through as we're evaluating new care delivery models, and whether we're going to bring on, I'll say, a new technology. That's the filter that we're looking through and applying to decisions.
I see. So how does that translate to the patient?
The intention is that really the patient is the center. And so we always have them in mind whenever we're evaluating what we currently do or when we're looking at something new. So we're always thinking about their health, we're thinking about their pocketbook, and we're thinking about the satisfaction of the care they're receiving. So they're truly at the center. So we apply this to really what we're already doing, such as the medical care nurse midwifery, but we'll also apply it to things we're introducing like group prenatal care, which we began offering last year.
Okay. I've recently, just in the last few years, my wife and I have had 2 children, so I went through the whole midwifery thing. But what is group prenatal care?
So group prenatal care for us is the specific model we use is called centering pregnancy. So women have their first prenatal appointments just as they would with, I'll say historically, one-on-one care. But around week 16, they join a group of women and partners who are all due around the same time. That group is led by a provider, and WHA's groups are currently led by nurse midwives on our Peter Court campus in Southwest Portland. Everything that happens in a traditional one-on-one care happens in a group. But patients also get the benefit of learning and sharing with other women and partners who are going through the same thing.
Right.
There's a lot more time in centering pregnancy to talk about topics like childbirth, breastfeeding, postpartum depression, parenting, which means that the women and their partners also often feel more prepared without having to take additional classes.
Absolutely, and I imagine having that kind of face-to-face connection with someone is a lot more important, a lot more effective than navigating the often difficult web of mommy blogs and websites and the like.
Right, because you kind of have that trusted facilitator in the room. You do have that knowledgeable facilitator. And it is truly, I went through a mock one myself, and it is truly amazing, just peer-to-peer learning and how effective that can be.
Yeah, I'm learning a lot of that actually from my daughters. I have a 4.5-year-old and a 2-year-old, and watching how fast the 2-year-old is developing compared to where her sister was. And both of them are very smart kids, but the second one having the example put forward by the older child, it's astonishing how fast she's picked stuff up. Astonishing.
Well, good luck with that.
Yeah, right? If you're just joining us, you're listening to Metroscope, a series of interviews with people of interest in Northwest Oregon and Southwest Washington. I'm your host, Ted Douglas. My guest today is Brian Kelly. He's the CEO of Women's Healthcare Associates, and we're talking about everything having to do with their organization. Of course, if you want to catch up or check in on these guys afterwards, you can certainly go to their website, which is WHALLC.com, and find out everything that they have to offer. It's really a unique and finding out to be quite sprawling organization. We've had these new models of healthcare being kind of spread down the line over the years. They're getting put more and more into effect. How does what does the future hold for healthcare, and how is it going to affect you guys?
Well, one of the really exciting things that we're working on is the maternal health home model of care, and we're actually piloting that in our Newburgh, Tualatin, and Peter Court offices. Peter Court is our Southwest Portland office, and so that's something we're really excited about. You want me to tell you a little bit about it?
Yeah, please.
Okay. It can be somewhat of a confusing name, but it really is a simple concept, and it boils down to coordinated care for the whole person. It's based on a model of care called the patient-centered primary care home that many of your listeners may have either heard about or experienced with their own primary care clinician. But in the maternity area, in the obstetrics area, what it basically means is from the period just before conception, during pregnancy and childbirth, and in the postpartum period, will be the woman's home base for all of her health care. And if we don't provide the service that she needs, we'll make sure that she is connected to other healthcare providers and resources. It's important to note that we're not just talking about Medicare. We're talking about other services as well. I mean, you can imagine dental and mental health.
Sure. Those
types of services that really affect overall health. We can help and coordinate and connect women to those resources. And we, but also the healthcare community overall, we're really recognizing that health is so much more than 20 minutes that you spend in an exam room.
Right.
It's influenced by a great number of social and psychological factors. And the more we can do initially to identify those issues in a patient's life and proactively get her the help she needs, we believe there will be better health outcomes and we'll be able to lower the total overall cost of care. And when I get excited about things, this is one area that I feel really excited about because, we're really focused in on that obstetrics and gynecology, but we also recognize that there are other influences on health care, and the amount of conversations we're having with other service providers now is just really exciting, and the collaboration that's happening is also really exciting, and I have a lot of hope that we'll be able to really improve health outcomes.
Yeah, I've noticed, I talk on the show a lot to all kinds of various charitable organizations and nonprofits and such, and just to use an example, like the people out there helping the homeless community, there are all of these individual organizations that are helping out, and all of them have connections to all the rest of them. So it makes this web. So if their particular service that they offer is not something that this person needs, they will recommend going to this other organization, and back and forth. And it's like that, there's probably 10 major organizations that help out the homeless in just the Portland area.
Right.
And it creates this web of help. And it seems to be something pretty specific to the Northwest, this kind of inner workings with charities where it isn't a bunch of islands, it's kind of this network. And it's very cool to hear that that's also happening in the local healthcare field.
Right, and if you can coordinate and really bring the term is collective impact. The hope is through those collective resources, and if you can coordinate and collaborate and really bring that in an efficient way, we'll really be able to make a difference. Whether it's healthcare or education or like you're mentioning homelessness, it's really just getting the right organizations working for the person when they need it, and really making an impact.
And what I think that says overall is that these organizations like your own, like Women's Healthcare Associates, are really about your customer, your person you're trying to help out. It's more about them than it is about your bottom line.
Right. That absolutely. And that's ultimately, really to do well in business, that's really any service business, that's what it has to be.
Yeah. I wish there were more who thought like you. So with all of this change in the healthcare industry, it seems like just about everything changes constantly. Is there anything that is a constant that's not changing?
Yeah. I mean, you probably hear it a little bit. I think we truly have a passion for the women and families that we care for. It's not just the quality of care we provide, but it's the patient experience of her care or the family care that experience is really critical to us. It's very important, and it has been for a long time. We're also very values-driven. It really gives us a strong foundation to face kind of any change. And so, like, our value of service to others, integrity, professionalism, having a positive clinic environment both for the patients and for our staff, as long as we continue to follow and utilize our values day to day, we really feel like we can maneuver and come up with really good solutions for the challenges that we face.
Right. Well, that's a perfect answer, because anything that comes along that changes you, if you keep those things, if you keep your focus on that patient experience, and you do keep things value driven, then certainly anything that comes along, you're going to be able to tackle and have a decent outcome for your patient.
Yeah.
Yeah. Very cool. So you clearly, speaking to you for the last 20 minutes or so, have a massive passion for this, and it's been something you have focused your entire career around. We started the interview off hearing your long line of jobs that all seem to touch on healthcare in one form or another. And here you are now the CEO of Women's Healthcare Associates. So this will sound a little cynical, but with all of these changes, with all the debates and arguments and everything going on about the healthcare system, how is it that you maintain that passion?
Yeah, I think it's a very challenging time for sure, and as human beings, we tend to resist change. I think I've really truly gotten to the point where I've embraced it, and I always really get back to, and my biggest source of motivation has always been our people, and the people are what make WHA a great place to work, but also a place where people get great service. And I think if we take care of our people, they'll take great care of our patients. And I'm just really excited about the potential opportunities that are really being presented to us. And our ability to continue to be of increased value to our stakeholders, whether it's health plans or patients or to health systems, to the purchasers out there who are really struggling with finding, with these, increasing costs. I really am at a hopeful place because I really think that the really important conversations are happening. And we're a part of those conversations, and that's really exciting.
That's so cool. And it's so nice to hear a CEO of a company, and of course we're talking about a healthcare organization, but you guys are a company, but to hear a CEO say that you take care of your employees first and the rest kind of sorts itself out. You keep your employees happy. It seems like more and more you hear of these, huge corporations, and then you get down to it and you find out that that's kind of the core of like Costco was, recently I read a big article about Costco and how they keep their employees very, very happy. And they're one of the most successful companies in the world. Sure. Because you keep your employees happy, they're going to do a better job for you. They're going to be happier, especially in your field when they're dealing with patients. Right. You want them to have a positive attitude. You want them to make it kind of a team effort. Right. I want them to be present. Yes, that's a great word. When a patient presents or comes to them, I don't want them to be thinking about, some things that, whether, it's their... Well, whatever. I want them to be focused, be able to be focused. So if we can take care of their dental and we can take care of having a good place to work and they feel valued, and their sort of tank is full so they can take care of the patients when they come in and are in need. Yeah, that's fantastic. Well, I'm sure it got to be one of the many reasons that you guys were actually named top workplace last year by the Oregonian. Yeah. That's pretty exciting. Yeah. It's got to feel pretty good as the CEO. Yeah, it really means a lot. The employees are actually the ones who nominate for that award and then actually vote to put us there. And really, we've been very focused on our staff, again, and our patients, but we on our trying to create a really good work environment for many years. So, having the hard work that's been done by many people in the organization reflected in the staff's responses in the survey, that was very gratifying. I would imagine so. It's got to be a part of what makes you excited to come to work every day. Yes, very much so. So you've been in this business for a very long time, and we're also coming up here on the end of our time, so this would be a nice way to wrap it up. But what is it that, outside of having your workers vote you one of the top workplaces, what is it that makes you excited to come to work every day? Well, I'll tell you, I've shared, I'm really kind of excited at where we're at in terms of, I'll say, the dynamics in the marketplace and the collaborations. I really like the fact that our organization is involved in our community, even beyond the care that we provide within our clinics. This month we're supporting the March of Dimes. Next month we're working to raise awareness for heart disease with the American Heart Association. That's one thing. Got to remember the number one disease in women is heart disease. Mm-hmm. And, we work with Clackamas County Women's Services. We work with Providence Prenatal Clinic, Washington County Community Action, Project Access Now. And these are really programs that really serve some of our most vulnerable members in our community. We just recently joined the Beaverton Community Healthcare Collaborative to improve access to coordinated care in Beaverton. These are just examples of things that I think really have an impact, beyond our clinic walls that
And that's also really exciting for me, that our organization, number one, can have an impact for obviously the patients as we interface with them, both in the clinic and in the hospital, but our organization can also have a broader impact with those other agencies on the broader community. So that's exciting.
Very, very cool. Well, thank you so much for taking the time to be on the show today.
Thank you.
Absolutely. So again, I've been speaking with Brian Kelly, the CEO of Women's Healthcare Associates, and you can find out more about them at whallc.com. And I think that's going to do it. Thank you so much for coming on the show.
Thank you.
All right, that'll do it for this edition of Metroscope, an Entercom Communications public affairs program. I've been your host, Ted Douglas. If you have a nonprofit or public affairs organization that you would like to let others know about, please email me at metroscope@entercom.com, and Entercom starts with an E. And please put Metroscope in the subject line so it doesn't get snagged by my spam filter. Or you can go directly to this station's website, click on the community link, and submit your information there. Also, if you'd like to hear this program again, you can visit our podcast page at metroscopepdx.com, where you will find this and the last couple of months worth of episodes. And please feel free to post it to your Facebook, your MySpace, your blog, your Twitter, your Google+, whatever you got. Let's try to get this information out to as many people as possible. Well, thank you again, Brian. Thank you all so much for listening. This has been Metroscope.